How are blood clotting problems diagnosed?
When we suspect a patient who are having either a bleeding disorder or a clotting disorder, first we take a detailed personal history, meaning that we ask the type of bleeding, the intensity of bleeding, the pattern of bleeding, and the frequency of bleeding and so forth. Then we also ask in detail about the family history, if there are a familiar pattern that's happening within the other family members, because this is quite peculiar with inherited or congenital conditions. The other thing, we ask the patient regarding the kind of medications that the patient consume. At the same time, we also ask if they have been consuming any other herbs or supplements, because that also plays a role in either risk of bleeding or clotting formation. Now, once we have got all this history, the next thing that we do is we do a proper physical examination. We are looking for any signs of bruising, any signs of bleeding to the joint and so forth. Once you have a detailed history and also a physical examination, then we do a full blood count. We look at the platelet numbers. And number two is we do a coagulation profile. So we look at the PT, which is the prothrombin time, to see how long it takes for the blood to clot. And we look at the APTT and also the INR. These are all proteins and factors that basically play a role in the clotting. At the same time, we can go a little bit detailed to look at the thrombin time and also the fibrinogen. Yeah, so all this basically too much and too low also has a risk of either bleeding or clotting. After we have done the routine coagulation profile, blood counts, next we do a specialized blood test. Number one, we look at clotting factors. Particularly, we look at factor 8, factor 9 levels, and we also look for inhibitors in this factor 8 and factor 9. Number two, we also check for von Willebrand factor levels and also activity. Yeah. And we also do a thrombophilia screen where we actually look for the quantitative values of factor 5 Leiden, protein C, protein S, and also antithrombin 3. Once we have done all this, next, if we suspect any clot formation, depending on where the clot is, we proceed to do imaging studies. For example, if we suspect a clot in the lower limb, then we do an ultrasound Doppler to see where is the clot, in specific which vessel is affected, whether it's proximal or distal, to see the extensive of the clot formation. Number two, if we suspect patients having a pulmonary embolism, then we do the CTPA, CT pulmonary angiography. Yeah. And if we suspect patients having stroke, then we do a CT brain or MRI brain to identify where the thrombus is sitting. Imaging plays a role, number one, to confirm the diagnosis, and number two, to look at the extent of either the clot or the bleeding.